Mechanism of action of opioid analgesic. Opioids exert their major effect by interacting with opioid receptor in the CNS. Opioid activate 7 transmembrane GP cells located presynaptically and postsynaptically along pain transmission pathway. A part of family of G protein complex receptors. It also open potassium channels and high densitized opioid receptor known as mu kappa delta, which are found dorsal horn of the spinal cord are higher CNS center. Now, preventing the opening of calcium channel via the potassium channel, it inhibits the release of other neurotransmitter. You can see by this image how the opioid analgesic are doing their action. You can see this mu, delta and kappa agonists reduce transmitter release from the presynaptic terminals. And mu agonist also hyperpolarized second order pain transmission neuron by increasing potassium conductance, evoking an inhibitory postsynaptical potential. Means mu have both function on presynaptical as well as postsynaptical neuron. Now, morphine. It is the most important alkaloid of opium. The dried juice obtained from the capsules of Papaver somniferum. Opium contains many other alkaloids, example codeine, thibabaine, papaverine, etc. Morphine is a natural opium alkaloid. It is dried extract obtained from the capsules of the poppy plant known as, just I told you before, Papaver somniferum. It is required approximately 10 kg of raw opium to produce 1 kg of morphine. There are some properties of morphine like it is good for treating dull, constant pain rather than sharp, periodic pain also. The side effects are included depression of the respiratory center, constipation, excitation, euphoria, nausea, pupil constriction, tolerance and dependency. Morphine generally affects produce a pharmacological effect on CNS like in two categories process. It has mainly CNS depression effect but also has stimulant effect at the certain sites of CNS. The depressant effect are analgesic effect like mediated mainly through mu receptor at spinal and supraspinal sites. It is the most important action of morphine. It is very potent and efficacious analgesic. It causes sedation, drowsiness, euphoria, makes the person calm and raises the pain threshold. The next uh, is euphoria. It is an important component of analgesic effect. Anxiety, fear, apprehension associated with painful illness or injury are reduced by opioids. Sedation. Morphine in therapeutic doses cause drowsiness and decrease physical activity also. It also shows some respiratory depression activity by direct effect on the respiratory center in the medulla oblongata. It reduce both rate and depth by the reduced sensation of respiratory center to CO2. It also suppresses cough by the direct action on cough center in the medulla. And the last one is hypothermia. In high dose, morphine depresses temperature regulating center and produce hypothermia. The stimulant effects are mainly meiosis. Morphine produces constriction of pupils due to stimulation of three cranial nerve nucleus. Some tolerance develops to this action. Pinpoint pupil are an important feature in acute morphine poisoning. Meiosis is not seen on topical application of morphine to the eye. Else, nausea, vomiting are there, and vagal center. It stimulates vagal center in the medulla and cause bradycardia. At the CVS, morphine produces vasodilation and also it decreases the BP. It mainly causes vasodilation of peripheral vessel which result in shift of blood from pulmonary to systemic vessels leading to relief of pulmonary edema associated with acute left ventricular failure. Next, morphine does affect on GIT also. It causes constipation by direct action on GIT. Thus, CNS action decrease GI motility and increase tone of sphincters. Urinary bladder. It may cause urinary retention by increasing tone of urethral sphincter. Else that it also can show effect on biliary tract and bronchi. The pharmacokinetic action of morphine, you can see the absorption of morphine from the GIT is slow and incomplete. It have quick effect those produced on subcutaneous injection only. It is partly bound to plasma protein. It is metabolized by conjugation with glucuronic acid. It is almost completely excreted in urine within 24 hours and bioavailability is 20 to 40%. It, it is mainly given by subcutaneous. Onset of action is 15 to 20 minutes and peak effect in 1 hour. The duration of action of this morphine is 3 to 5 hours. Now, some adverse effects are here. You can see nausea, vomiting, constipation, respiratory depressions also, hypotension, drowsiness, confusion related problems are there, itching and skin rashes also a adverse effect of morphine. Next is difficulty in micturition. Uh, it also produces some drug tolerance which is developed to most of the effects of morphine. There is cross tolerance among the opioids. It also produces drug dependency. It is the main drawback of opioid therapy. Psychological dependence is associated with intense craving of for the drug and acute morphine poisoning. The characteristics triad of symptoms are respiratory depression, pinpoint pupil and coma. The other sign and symptom are cyanosis, hypotension, shock, and treatment of acute morphine poisoning is generally hospitalization, maintain airway, breathing and circulation, ventilatory support, gastric lavage with potassium permanganate, etc. Now, some withdrawal symptom of morphine are there. Sufferer feel cold shakes, chills and sweating of both. Fever-like symptoms are present, mood swing, anxiety and depression like side effects can be shown, bone pain, vomiting, insomnia and diarrhea also.